Dr. Kyle Osbourne, welcome to Chronically Real. What's up?
Thank you guys for having me. I'm doing well. It's the weekend. Can't ask for anything better than that.
Sweet. You're
Oh
up in
yeah.
Philly or over in Philly on the East Coast, huh?
Yep. The place that Rocky built and Will Smith and all the other Kevin Hart, all the other notable folks. This is where we are, where we hang out at.
My father was raised in Philadelphia.
Oh, really? What part?
I don't know. I think it was the city of Philadelphia. I'm not sure. And I do know my grandfather still lives over there somewhere.
Okay.
And I don't know exactly where. I don't really have a connection with that side of the family, but they are there.
Okay. Yeah, we are a pretty cool spot, especially as food goes. We are an
Ooh.
excellent melting pot of food, very diverse. So if you ever make your way over here, I mean, outside of course the typical the cheesesteaks, things that everybody raves about, we just have a plethora of great food. So yeah, I highly recommend you swing on by and get your grub on.
That's right. City of brotherly love, right?
That's right. That's us.
So what do you do over there? How do you keep yourself busy in your free time?
I'm a big subscriber and indulgent of like entertainment. So I'm a big sports fan. I'm a huge movie person and television. So the summer season, it's right up my alley. Like this is like game time for me. So, like all the, being that, a lot of the movie theaters and industries have, the restrictions are becoming less intense, so people are going out into the movies. So, it's the summer blockbuster season, and so I'm making my way through all the movies that are coming out. So I already saw like Doctor Strange. I'm a huge Marvel fan.
Yeah, that was a trippy movie.
Yeah. Oh man, I think that was like their version of a horror film for Marvel.
Yeah.
That's the way I took it. But it was good. It was good. I'm a huge Marvel fan. I'm there like opening night for all their movies. So Jurassic Park is right around the corner. Thor is coming out next month. So that's
Ooh, I can't wait
my
for Thor.
self-care.
Let's go.
Yeah. Thor. It looks good, doesn't it?
Oh, it does.
Yes.
Yeah.
It's great.
Excited.
So I'm catching up like on Stranger Things. That just dropped last week. So I'm running through them, man.
That's good. You go to school out in Philly?
Yeah, so all of my school and academic experience was right here in Philadelphia or like the Philadelphia surrounding areas. So for undergrad, I went to Cheney University, which is a HBCU, which is probably maybe about 45 minutes to an hour, depending on how you drive, outside of Philadelphia. That's where I got my undergrad, and I was a science major, and then halfway through, I attempted to switch to psychology after some life stressors that took place, and I was too far along as far as like my restricted bio and science elective. So what I did, I just finished up my science degree and then got like an unofficial minor in psychology. And so from there on, I went and attended LaSalle University, which is right there located in Philadelphia. And I attained my master's in professional clinical counseling. I think it's called something different now since I've left. I think it's like professional clinical counseling psychology, something rather. So I got my master's in that. And then I went on to get my master's and doctorate in clinical psychology at Philadelphia College of Osteopathic Medicine, which is also located right there in Philadelphia. I know a lot of people outside of their medicine, the Philadelphia 76ers also used to practice there. That's where they used to practice before they moved over the bridge to Jersey. So, so the majority, all of my schooling has been right there, homeward bound.
Okay.
How long
And
were you
what
in
was your
school?
dissertation in? Oh, go ahead. DO3.
School took about 11, 12 years in totality. I want to say, yeah, I make that grimacing face every time I think about it too. Yeah, it's a long it's a long road, you
But
know.
what was
But
your dissertation in, man?
a dissertation was involving female that have lupus, and I'm looking at the relationship between cognitive distortions, coping skills, social support, and quality of life. And what led to me choosing that topic was, as I said briefly a little while ago, while I was in college, unfortunately, my mother passed away from lupus complications.
Yeah.
So thank you. So in 1996, she was diagnosed with lupus, and she was able to recover from her initial flare. It was a tough road. It included physical rehab. It included being on just a lot of different medications. And for those that aren't aware of what lupus is a condition in which the body attacks its own tissues. So a lot of times in circumstances, it can affect your kidneys, it can connect your lungs, your skin, other different vital organs that, and it's a very difficult disease. It's difficult to diagnose for the reason that many people, I think they deem it as the mystery disease. And sometimes it also tends to mimic other conditions. So a lot of times, unfortunately, it tends to be like a rule out diagnosis when they've done all these other different these diagnostic exams, and they diagnose you with this and this didn't fit, and they diagnose you with that didn't fit, and eventually it's like, oh well, it's lupus, right? When you can't explain it to anything else, it's lupus, and that's difficult if you're thinking about just being in the patient's shoes, for the reason that while they're trying to figure out, you're in immense pain, right? You're maybe being treated incorrectly or ineffectively, and it's a difficult process. So we recently, May is Lupus Awareness Month, so we tend to, depending on the chapter and the organization of where your lupus foundation is located, they tend to do like some of the different fundraisers and some of the walks that they do. So my family, we've been involved in the Lupus Foundation, the one here in Philadelphia, and we just recently attended the Lupus Walk in New Jersey and in New York that they had at MetLife Stadium, which was pretty cool. So when I made my way into my doctoral program, and they were kind of going over, okay, these are some different topics and some interest regarding, just thinking about your dissertation topic. I knew right off the bat that lupus was something that I wanted to be involved with, and in some form or fashion be able to say, okay, how can we advance some of the research and what the emotional and psychological component that patients are experiencing with lupus. It's, over the course of time, it used to be primarily, or it was a condition that primarily affected middle-aged Jewish women, white Jewish women. And somewhere over the course of time, more recently, within the past 20 to 30 years, it's been a condition that mainly affects about, I want to say 15 to 55 female women of color. Or that childbearing age, especially is when we're seeing more people being diagnosed with that condition. So and so that's where some of the research lies, is that they're trying to figure out, okay, what transpired over the course of a generation that now it's affecting this population of individuals, more in particular, especially women of color of childbearing age. So it was a great opportunity for myself to engage with more of that population, just outside of some of the folks that I would see at like some of the fundraisers and at some of the walks and things of that nature. So being able to attend some of their support groups and being able to create a relationship with some of the organizers and some of the individuals that work at the Lupus Foundations, especially the one here in Philadelphia, has been a great opportunity, working with some of the, talking to the pharmaceutical reps, the rheumatologists that have lupus clinics at either Penn or at Temple. It's been a great opportunity. So just being able to be involved in trying to find a cure and treat this population has been great.
Awesome, man. So you have this personal experience, this personal background with chronic conditions or chronic illness. And you also have experience in your clinical work with chronic conditions, don't you?
I do. So I've had the opportunity, especially either through schooling with different clinical rotations and also just after school, of being able to work in a lot of different medical settings. I've had an opportunity to work inpatient in regards to at a very prestigious research hospital here in South Jersey. I was able to work with the behavioral medicine division, and we were able to actually do inpatient consults with individuals that are suffering from just various conditions or being hospitalized, whether it be cancer, it could be lupus, it could be diabetes, it could be any form of any chronic illness that unfortunately requires, or a person may experience a flare and they're hospitalized. And so I'm happy that more of the hospitals are starting to add that mental health component, where they're having clinicians come in and being able to do consultations while the person is hospitalized. So I had an opportunity to do that and work with that, the medical population in the inpatient realm. I've also had an opportunity to work at the VA hospital, because that was one of my interests as far as working with veterans and working with trauma. So working inpatient and outpatient, and having chronic illness, which is a part of a lot of veterans. I mean, just overall the general population, but especially veterans and what they present with. In addition to their trauma, there's always that medical component. And I think that was one of the benefits of being able to work in a medical population, is that it's something that I always go in and consider, even to this day, and working in a psychiatric inpatient facility that I currently am employed in now, is that it's keeping in mind the medical component. A lot of times that's something that I'm not going to say, I think it's getting better, but however, it was just always focusing on the psychological or the mental health component, and not understanding or taking into consideration that this person is, has diabetes. This person may have this other chronic illness that's also contributing to how they're presenting in front of them, what's contributing to some of their behavior, some of the also emotion dysregulation. So I always keep that, that mindset going into, and, in the first session when you're meeting somebody and you're going down just kind of, you're getting their history. So it's okay, what's going on and what have you experienced medically? Okay, what are some of those symptoms and what's going on in that area? But that absolutely has a huge impact on, what someone is struggling and what they're dealing with.
Because chronic illness, that's an endogenic thing. It's not produced in the psyche. It's a bodily, something's happening within the organism itself. It's not produced as imbalance in the brain or something like that. Whereas a psychogenic thing is something like bipolar or some other mental disorder, schizophrenia. Now, in my readings, right now I'm doing an in-depth study of Carl Jung and what his influences were. He was studying a guy by the name of Gustav Caras, who said that the unconscious doesn't know disease. So my theory is that when we have an endogenic thing going on, something that originates from the body itself, then that is, we create our own thoughts, and we bring into our consciousness, the field of consciousness, the disease itself, and we create those feelings and thoughts ourselves, because the disease originates from a bodily place. Does that make sense?
No, it totally does. I'm thinking of an interview that Carl Jung did. I think it was with one of his colleagues, and it was pertaining to what you just mentioned. And he had indicated that, he said 50 years ago, we already had these cases. He said, we had ulcers of the stomach, we had tuberculosis, we had chronic arthritis, skin disease. He said all are psychogenic under certain conditions. And he went on to say that it's always been a question of how to treat these things, because any disease possible has the psychological component in the accompaniment. He said it all just depends on how we treat the patient psychologically in the proper way or not. He said, and when you're able to treat the disease, because when the disease is established, like you were kind of mentioning, is that there's a high fever, there's an abscess, right? That comes once it's activated, right? Because there's a lot of sometimes patients, or there might be like a genetic predisposition, or there might be other different biological factors. He says, once the abscess or the fever comes to the forefront, he said you can't cure it by psychology. He said, but it is quite possible that you could avoid it or reduce it with the proper psychological attitude. And I think that speaks exactly to what you just mentioned. It's going to be, the perception, right? It's going to be like some of those thoughts and things that are involved or that are associated with the condition, especially with certain conditions and certain illnesses present differently, are going to have different accompaniments. So if we're able to take that consideration, which is good. I think some clinicians, especially in the medical populations, are starting to get better with taking that into consideration. However, I think this is absolutely the place and part where we as mental health clinicians are able to come in. If we're able to treat that component in the right frame or effectively, then I think it's absolutely going to have a tremendous effect on how you're also treating the illness and treating the condition. So I'm happy. Young with Gustav, they had a lot of different. I always enjoy reading their theories and their concepts, especially as it pertains, with the disease. Because even though this was years ago, we're talking a generation or so ago, it's still very, very impertinent that we still continue to read up on it, because it's still very.
It's come to be like an axiom, huh?
Right. Exactly.
And speaking of Carl Jung, we know that it seems you're familiar with the structure of how the mind works. And one of the things he put forth was the idea of a persona. We present ourselves to the social structure, how we want people to see us. Now, I know in the past, I've put on a persona of being stronger than I really was. Or if I was in pain, I wouldn't allow that to be shown or seen by anybody. So I had this mask on, and what I discovered in my personal experience is that was damaging to me. That was not good for me. And over time, I had to learn how to communicate and be more open with my neurological disease. Does that make sense?
It makes huge sense. And I think that's something, what you just explained is what a lot of individuals that are experiencing chronic illness are faced with daily. Unfortunately, it's, society, depending on, your culture or your environment that you were raised in, it's always, like you said, it's lacing yourself up by your bootstraps. You're still going to go into work. You still got to put on this brave face, right? You still have to go in and you have to do the job. And unfortunately, at times, grimacing or showing any type of weakness or things it's inexcusable, right? It's in the way of productivity. And you have a lot of individuals that are suffering in silence. They may be being productive, but they're also suffering in silence. And then you also have to think about it. Well, to what extent are they really being productive if they're doing more damage to themselves, especially physically, right? You're overexerting yourself. You're you're emotionally and physically. And now your disease process and the prognosis is decreasing. The more that you're continuing to serve, the more you're continuing to put that emotional mask on, and you're just decompensating on the inside. I think that's something that that's one of the biggest symptoms or issues as far as with chronic illness and mental health, is that individuals are overexerting themselves, or they're doing themselves such a disservice so they can keep up that appearance, because you don't want to be looked at as weak, right? You don't want to be looked at as a burden. You don't want to be looked at as less than. And so in that sense, and it can be just different things, right? It can just be very ancillary things that we do in life, whether it's overexerting yourself and going food shopping and trying to carry all the groceries and all the different things in, or
That's totally mean.
right? You're doing all of these things that are, could absolutely activate, an inflammation, right? It could activate a flare. It could do all these other different things. You're trying to do all of these activities and run all these different errands, throughout the day, and when at work you're given a project, and you know how physically taxing and stressful taking on this project is. However, you're still going to do it because maybe you're concerned about job security, or you're worried about what you're anxious about what your coworkers or management are going to think or say, or your evaluation. So that's one of the the toughest things that that population deal with and have to experience on a day-to-day basis.
And I also see an angle where that could lead to maladaption as well, not really integrating into society. You know what I mean? And also not only that, but individuation or integration of other qualities, because you have this ego in that's the center of your consciousness that's just overwhelmed by the persona.
Totally. Especially like you mentioned, you're going to start utilizing these other different maladaptive strategies, and especially in our society, these maladaptive strategies tend to be, well, they need to be instant, right? Instant gratification. It'd be immediate relief of symptoms. And so if you overwhelmed yourself, whether it be physically or emotionally, with work, with stress, these other different things, then you're going to look to find quick relief. So whether that's going to be indulging in over medication yourself, or that's going to be drinking, or that's going to be a different substance, because again, that's more the social, acceptance, where it's like, oh, we're just going to go hang out, we're going to do these other different things, but you want immediate relief so you can go back out and work as hard as you did before, right? So this is where it becomes like a very vicious cycle, and we get so attached to that particular identity of being strong. Whereas that, okay, well, if I can't work, or I can't do the things that I used to be able to do when I was maybe at more optimal health, then not only am I concerned about people looking at me differently as an individual, I'm also looking at myself, right? It's that loss of identity that continues for a person to overcompensate or overwork or overexert themselves. And so that's where, you're integrating yourself with all these other different maladaptive things and issues that, again, are just going to just wear you down. And it's so difficult, because then that also prompts isolation, where you're just keeping all that information, you're keeping all of your suffering, all these things, you're keeping it to yourself. You're not even telling, your loved ones, maybe people that you're closest to. You're internalizing that, and you're keeping all of that to yourself. And now you're trying to find ways to keep up that status quo, right? Continue to, so it doesn't look like I'm any less of where I was before getting ill or getting sick.
I think that leads to behavior such as projecting too. You have this, as you mentioned, these maladaptive strategies surfacing up from the personal unconscious and your memories, and they're attaching themselves to your experience. And then now you're like, whoa, you can't even function right. And then when you get upset, now you're starting to project on people around you. And then they're viewing you differently. Then you get down on yourself. And it's like that circle you talked about, that vicious cycle.
I like to call, especially when you're talking about like chronic pain, that frustration, anger, and a lot of times anxiety are like chronic pain's unwanted, accompany, right? It's unwanted company for the reason that absolutely, like if you're in a tremendous amount of pain, you're totally going to project that onto whatever's in front of you. You're going to project that onto somebody, something, whatever's in front. When that flare shoots up, you're totally, it changes everything, right? You're having these thoughts of, oh, this is ruining my life. I can't take this. So if you're having those thoughts, then that's going to contribute to the emotions, right? The frustration or the anger. And then that behavior, that maladaptive behavior, I'm going to hit something, I'm going to hit somebody, I'm knocking something over, I'm pushing. You're irritable all the time. Like, yeah, now, like you mentioned, people are going to start to look at you and say, oh, what's this guy so angry about? He's got anger issues. Or what's his problem? And a lot of times, because if people aren't informing those of what's going on and what they're experiencing, it's that, okay, you don't know. So you're just seeing the behavior. People are only seeing the outward behavior. And there's so much beneath, right? And at the root of it, it's the illness. It's the pain that started off this cycle, that started off this trend of a pattern. And their own people are only seeing what you're projecting or what you're putting out.
Have you ever? I'm sure you have heard of gaslighting.
Mm-hmm.
And I've talked to individuals who claim they've been a victim of gaslighting. Could you talk a little bit about that and what individuals with chronic illness can do to combat that?
The tough part, especially now, historically with gaslighting, and it's funny how we call it gaslighting now when it's been around for years, right? It's been around for years, especially historically. It's been very prevalent among women, especially younger women, women of color. Where they have been treated and diagnosed differently than men, right? Even when they have the same medical complications, even when they have the same health conditions, they have unfortunately been historically treated differently. And I think there was a study that came out through the University of Colorado that compared that showed that women face longer wait times and it takes longer for women to actually receive different diagnoses when it comes to cancer, when it comes to heart disease, when it comes to, they're treated less aggressively when for traumatic brain injuries. And they're less likely to be offered pain medications also. And so now, we're getting a term for it, right? It's called the gaslighting. And it's a situation, unfortunately, where before it was you're just receiving a poor quality of care. And with situations like this, I know there was a patient or a client that I encountered a few years ago that it took her, and she was a lupus patient. And before she was diagnosed, she said that the doctors said it was allergies. Right, they would, just kind of wave it off. Oh, it's allergies, or she went to see another physician, and the physician said, "Oh, you're most likely you're pregnant." Let's look at these other different things. So, constant invalidation, constant, misdiagnosis, constant just minimization, and it took her a few years to finally get the correct diagnosis. Wow. And when you have someone that goes through this particular cycle, what I remember her saying to me is that it felt like they were saying it was all in my head. That's what it really came down to. Whenever I would ask for more tests, she said it just felt like they were saying that I didn't know what I was talking about. It's all in my head, and, it's just this. It's something more minimal. And so you have to think what that does to any individual. Right, you're constant. Your body better than anyone. That's always something that I lead off with any of my clients, especially when there's a medical situation that's taking place. Is that no one knows your body better than you. Right, when there's something off, even if it's like a smidge. When your body is kind of doing something a little differently. Now, you have the medical professionals that may know more maybe about the condition itself, just kind of due to training and school and things of that nature. However, this is where it's supposed to be a merger of the two. This is where
there's two knowings, right?
Go ahead.
There's two knowings, right? There's
Correct.
the intellectual standpoint, and then there's the internal landscape of the individual. And I posted about this yesterday, based on what Carl Jung said about disease, that the inner person is the one who knows what the doctor doesn't know. Because there's a feeling value, right? And then there's an intellectual standpoint. And I was telling my group that there's always going to be a conflict between doctor and patient or client unless the doctor realizes that he needs to talk to the patient through imagination, communication, empathy, so that those two knowings can come together.
Right. It has to be a merger of those particular ideas. It's like, okay, this is what I know. This is what treatment interventions and things of that nature that we have that have been helpful for individuals that have been experiencing some of the similar symptoms and things that you've been experiencing. And let's see how we can individualize it for you.
Yeah.
That's right. How it's supposed to be a situation where, like you said, it's a marriage, it's a blending, it's collaborative. And I think that's where, again, where we're able to have that training, because we're looking at it and say, all right, let's see what we can do that's going to fit the right shoe for you. And something that I think can be helpful in that sense is, one, continuing to advocate for yourself, continuing to have, I would say, it's good to have, if you're able to have support with you at those appointments. Maybe having a family member, having, a friend, someone that's also able to help you advocate for that. Documenting as much as possible when you're experiencing some of these different symptoms and you're experiencing a flare, right? So it doesn't just seem like you're coming in there and say, oh, well, it happens sometimes. It happens. How? Because this is going to be the question that most clinicians, when they come in and they're asking you about your symptoms, they're going to be asking you about frequency. They're going to be asking you about intensity. They're going to be asking you about duration. So when you're able to provide them with some more accurate information, I mean, I know we don't always have like a notebook or something around with, but we also have phones. So when you're experiencing that, and maybe after the flare has subsided or the symptoms or the pain symptoms have subsided or lessened, it's okay, this took place at 12:05, or this took place when I was at lunch. This took place, I'm noticing that it's taking place maybe during the day more frequently. The more information that they're able to provide the clinician, I think that puts, it's more accurate, it's more specific. Again, having, an additional, the advocate. And sometimes it's also a situation where we may have to go for a second opinion. That happens sometimes, and it's not ideal. And I absolutely recognize that it absolutely takes time out of your schedule. It takes time away from work. It takes time finding a new provider, getting scheduled, especially with most chronic illnesses, you're seeing a specialist. So we know how long those appointments can be, scheduled out. It can be scheduled months at a time. And at the same time, it's understanding, okay, if this particular person or this provider is not going to be invested in my health the way I am or the way that I feel comfortable, then sometimes we do have to, move to a different clinician. And I get it. I'm not going to put it all on clinicians also. I'm not going to throw my med guys under the bus, because I understand they're overworked, they're burnt out, especially given with COVID and other different considerations. It could also, sometimes it's a systemic issue where I think in medical school, the training has to be better. As far as like looking at it on a clinician aspect, the training has to be better at looking at the patient as an individual and taking into consideration what they're presenting with. Not just, okay, these are the symptoms. It's not adding up to this criteria. So it's not this diagnosis. I don't think it says, I know they see a lot of patients in a day, and that's something else that needs to be, taken into consideration and lessened, that they're not seeing as many different clients and patients throughout the day. So they're able to actually be able to listen, not feeling burnt out. There's biases that also go into any type of medical encounter. So I saw a study a year or so ago where there were physicians that experienced back pain themselves, that experienced chronic back pain. Those same physicians or clinicians were less likely to provide medication to clients that were coming in for symptoms of back pain or chronic pain. So right there, you have a bias there, because I imagine that, if I'm able to come into work and I'm able to provide you with service, I'm able to come in, then you should be able to do the same, right? Because I know what you're going through. And we all know that pain is not the same for every individual. So, I think it's training for, as far as clinicians, for, myself or, my medical cohort, for us being able to get more information, checking and being aware of our biases, being, knowing that we're looking at the individual, with, good eyes and a more healthier perspective. So I think those can be some things that can lessen some of the gaslighting, and hopefully we can start having more of our folks get the proper medical care that they deserve.
Carl Rogers was good at that, huh? That humanistic approach.
Yeah, he was. That guy was onto something.
Yeah, he was. Now, I noticed in the chronic illness community, I browse the hashtags and look at different communities on Facebook and in the community itself in real life. And they're real big on affirmations.
Mm-hmm.
And for me, in studying the works of Carl Jung, he talked about sterile ideas. He talked a lot about metaphysical experiences. And for me personally, when I told something to myself that was a popular affirmation, like, you're worth it, you're worthy, those type of things, it had an impact on me. In that moment, it did.
Mm-hmm.
And as soon as that revelation that I was a human being and I was worth something, I had what you can say a metaphysical experience. In layman terms, what do you say? A spiritual experience or something numinous. But that saying that again didn't have the same impact that it did when I first realized that I was worth something.
Mm-hmm.
So I'm not quite sure how effective affirmations are with somebody with a chronic illness. To me, it's a quick fix or just a Band-Aid to something that's deeper.
Yeah, I think affirmations are situations or are strategies and useful skills in that particular moment. And I think it's absolutely positive. There's so much research and data that supports it. But absolutely creating like a mantra or a positive quote or something that's meaningful to you, for ourselves, especially when you are experiencing a chronic illness, or you're experiencing a flare, or you're experiencing some form of like medical or physical distress, I think it's very important for the reason that it's helping you get through that particular moment. Right? It's the same thing, I think, similar to diaphragmatic breathing or say meditating. Right? We know that there's been plenty of research that show that meditation reduces inflammation. Right? We know that the same thing for affirmations and diaphragmatic breathing is that it's able to activate our PNS system, where it has that, even for that particular moment, it allows you, like you mentioned, to get through maybe that particular flare. And I think that's something when I particularly will facilitate a psychoeducation for, say, the medical population or someone that's experiencing chronic illness, is that this is not going to take away your pain, right? Overall, right? Mm-hmm. And I know sometimes that's maybe what some people are looking for. They're looking for, I need something that's going to take my pain away. Instead, it's not going to take it away, because there's a lot more happening. There's a lot more underlying issues that are contributing to the severity of your pain, the intensity of your pain. However, if we're able to get you through this particular moment, especially at the end of a workday, or you've just been worn down. It's 7, 8 o'clock in the evening. You've just done so many other different things. If you mention you have that affirmation or that quote that's able to get you over the hump, right? It's able to steer your brain. It's able to send your brain that message, because that's what it is. Our brain is always overworking. Right? We're always in that analytical brain. And if we're able to send that brain a message of, hey, you got enough in the tank, you can do this, you are strong, you are important, you are loved, all these other different things that, because our brain is always constantly moving. It'll throw some other different quotes in there too that we can sometimes get latched onto. And so if we're able to throw some positive mantras there, some affirmations that are going to be helpful for us in that particular moment, that's going to keep us off of that particular train of thought and on a more positive one, then absolutely, right? It's helping us get through that particular moment. And I've always been a firm subscriber of having multiple different affirmations for different situations, because for the reason that not every circumstance is going to require the I am strong or I am smart or I am whatever affirmation. It's good to have certain different affirmations for different particular situations that'll help you get over the hurdle. And at the same time,
So it seems to me there's context to an affirmation. It's very individual and personal to the person saying the affirmation. And that's a lot different than just spouting off things. Right?
Oh yeah, totally. I think, I think if you're just shouting off just some random phrase, it's going to be like, I don't know, it's not really applicable. Yeah, it's having something that's going to be effective that resonates with you. That's why sometimes you'll see a situation, where you'll see a situation where people maybe have affirmations and they have so many different ones on a mirror. That's going to get them through. And it's good to say, okay, what affirmations are going to work for you for this particular circumstance in this situation? Because everybody is different. There are so many different affirmations, and I feel like they all are great. However, it's going to be good to find the one that works for you, and also understanding that this isn't going to possibly take away the pain overall, because your pain is very real. It's going to be, okay, what's going to be helpful in getting us through this particular moment.
Mm-hmm. And that brings me to my next point of discussion is cognitive behavioral therapy. And to me, this is just my layman's opinion, is I don't think that either addresses the root cause, because of the works that I read by a follower of Sigmund Freud and an assistant to Carl Jung, Alfonso Meter. He developed something that was called brief psychology, like a rapid recovery system. And he mentioned, and I believe that cognitive behavioral therapy has its roots in this idea, is that individuals with chronic illnesses or individuals who have deeper issues, he claimed, wouldn't benefit from a rapid recovery system or a brief psychology. You think there's any merit to Meter's claims?
What I'll say is that there's always overlap. I think especially depending on what the individual is presenting in front of you, what their illness is, what their thoughts are or what their conception is of their illness, which is why I think even like the existential approach is helpful. Okay. Like sometimes you can have a situation where it's like, okay, even if you're CBT oriented, and I've been trained at CBT and I love CBT, it's been very helpful for a variety of different patients. Even with the CBT manual for chronic illness and for chronic pain, which has been very helpful because it brings awareness, right? It also, I think when the CBT, I think is very good for the educational aspect of, okay, understanding and seeing the cycle of pain that we just talked about. So when you're able to see, okay, this is why, this explains my behavior. Okay, this explains that we just talked about. It's very difficult. It's tough to see it when you're in it, as I like to tell some of my clients. When you're experiencing immense pain, you're not able to see, or maybe you don't know why you're lashing out the way that you are. However, what CBT has always been good, especially with the psychoeducation aspect, is actually when you see it in black and white. When I put it on the board for a client, now they see, okay, it's starting to hit. This explains it, right? You're also able to give examples like we mentioned, going to the market or going to work or all these other different things. The person's able to understand that aspect of it. What I've liked about, and it typically won't look at the root cause, and that's understanding that, okay, it's a situation where we're simply looking at symptom reduction. Okay, what we're trying to do is help you manage your pain. Okay, and what CBT does, especially with those manuals, is, okay, it's going to be, if you're taking medication for the pain, well, this is also going to help you manage and deal with flares. It's going to help you manage lifestyle, right? Under and overexertion. It's going to help you incorporate some of the different strategies as far as for pain management. Not taking the pain away or getting to what's causing the pain or the root cause. It's going to be, okay, simple as far as management. What I've liked, and sometimes what I've done in regards to incorporating the existential approach, is that what I like about that is that it allows you to understand the client and patient relationship in a more deeper manner. So, and I like the terminology that it uses also, for the reason that when you're looking at it, or when you use the existential approach, the patient or the client doesn't need treatment. They need healing, as I like to say, right? Because when you hear treatment, people tend to think or associate it with, it's something to do, right? It's something that I have to do. Where healing occurs, it's like, okay, the client and, myself as a clinician, we're interacting on a deeper level. Okay. Now we're looking at, okay, how are you viewing your illness, which is a very important concept. Even, before you get to the education piece, it's important for you to look at, okay, from the existential standpoint, well, how are you viewing your illness? Is it something that, is there meaning behind it? Are you creating meaning? Right. Or maybe there's no meaning at all behind their illness. I like that it takes like the subjective, or it's a unique subjective experience, and it's an evolving situation, right? You're looking at it as far as the client or the person that's experiencing the illness, as it's evolving, right? As their internal experience evolves. And so I think having the best of both worlds, and also still continuing to incorporate, okay, how is this person, how do they view their illness? For the reason that, they may not have had some of those same strengths. They may not have the support, right? When chronic illness occurs, this might have been their first, situation with adversity where they don't have any control. And having no control over a situation is a big, concept. This is a huge consideration to someone that maybe hasn't had to go up against something like this before. And maybe that they're thinking, especially as society, or maybe as far as culture, you live a good life, then nothing bad's going to happen, right? If as long as you do the things that you're supposed to do, then nothing bad's going to happen. Now this illness comes to play, and everything, your entire framework of how you perceive the world and society and life has totally been dismantled. So I think it's looking at some of these other different things, and I like the existential approach. I feel like it's sometimes, I don't want to use the word better, because then I'm going to have some of my colleagues coming after me. But I think it's an important, I think it's an important aspect, and something to take into consideration when you have someone sitting in front of you and they're presenting with, especially these medical or physical issues, is that we absolutely need to take into consideration of what's their perception of the illness, for the reason that, there may be a lack of insight there. And if we're able to evolve with that and maybe be more in the moment and work with that approach of why they think it may be taking place, then we're able to do some other work as we continue to evolve.
There certainly seems to be some utility in each schools of thought. And I noticed,
but it totally they overlap with each other so much, And I get some people have to, they have to pick a school of thought or an orientation, but there's so much overlap, and I feel like so many different things and theories and ideologies can be useful depending on what the person is presenting with, and then also their value system.
Mm-hmm. Absolutely, man. I agree. In chronic illness communities, I run a community where we're health focused. And in the last couple of years, I've introduced healing the mind along with the body as well. But over the years, since my 10 years of trying to create a chronic illness community to support people, there's been a lot of social rejection. And I think I sent you an experience out of Yale when an individual was rejected because he decided, okay, well, it's a smokers group, right? They all get together and they support each other so that they can quit smoking. That was the idea behind that support group. And one guy comes back during the next meeting and he says, hey, you know what? I just quit, and they're all rejecting him on a social level within this group because they haven't all quit. But he said, oh, yeah, it's possible. But they're saying, no, it's not possible because of addiction or whatever excuses or whatever they had. And then he felt the weight of that pressure. So he started smoking again, and they welcomed him back into the fold with applauding. And I think this happens in the chronic illness community. Is there a norm, you think, to reject health, to reject fitness, a healthy lifestyle, and to continue portraying yourself as somebody who's being victimized?
It was when you sent that to me, immediately, I'm a huge group therapy person. Like I love group therapy. That's one of the reasons why I've remained in the inpatient sector of mental health, for the reason that in any mental health facility or any inpatient hospital or such, one of the main or primary interventions is group therapy, because it's so powerful. No matter what the focus is, whether it be psychoed, whether it be a smoke cessation, whether it be depression, substance use. And I'm a huge Yalom person. Irvin Yalom, he's the guy when it comes to group therapy. And the way I remember his readings, and he was so accurate, is that when you do group therapy, there are 3 stages. And it doesn't matter whether it's a series of groups that can, this can take place within one group session. It could take place over the course of 2 or 3 group sessions. So the first session or the first stage of group therapy, especially when you sent me this excerpt, is orientation. So orientation is like communication style. People are meeting each other. People are hesitant to participate. You're trying to figure out what the group structure is going to be. So it was kind of like, you're kind of feeling where people are. You're kind of feeling out. The next stage is conflict. Okay. So what happens in conflict is that there's a lot of hostility. There's like people are trying to assert themselves for dominance. There's rebellion. There's hostility even towards someone like myself, like the facilitator or the group leader. There's criticism. There's so much going on, right, in the second stage of conflict. And then the third stage takes place, which is group cohesiveness, right? There's a development of cohesiveness, and there's more support of each other. There's more self-disclosure. There's acceptance. There's closeness and unity in the group. And it was like, as I was reading the excerpt, I was like, this is happening right there. It was almost like happening real time. And that happens. It almost never fails. I've done so many different groups, and I've seen it happen within one group session, and I've seen it happen over a series of different of groups. And that's where, when you get into that point, and it really just depends, I guess, on how large the group is, because then also you have to take in consideration some of the personalities and where that's the stage of where that person is, right? Where are they at? Are they in that, when they're coming to group, are they in that situation where they're in that stage of change of the pre-contemplation, where they're not even thinking that they need to be here? Like, are they being forced to be here, possibly either through legally, or is it a situation where like a relative is telling them to go to the group? Or is it a situation where they might be in that contemplation where it's like, okay, I think there's something going on here. I need to do this. Maybe there's a problem. Maybe there isn't, but I'm going to check it out. As opposed to maybe you might have some other group members that might be more in that preparation where they're like, hey, I know there's something going on here. Something needs to take place. I'm preparing to do the work. And then, the actions is actually, getting into and utilizing the strategies. And so you get to see in a group dynamic where everyone is. And so it's always it's a situation where I like to say, hey, even if you're kind of on the fence, just come in, just listen. Listen to some of the information. If it's free, you don't have to talk. Group therapy is elective, right? So outside of you being court mandated, you don't have to be here. But, see what it's about. And there's so much power in seeing someone that's experiencing the same thing. And not necessarily, the group leader or the expert in the room, but however, the same person that's speaking to the same experiences and speaking to the same power and circumstances that you're experiencing. And even with that, if you're able to get enough support, and it seems like this group, where they like said, when they came to a decision where they're like, hey, we're going to welcome him back into the fold, despite whatever their decision is, they've gotten to a level or gotten to an area of cohesiveness where they're just like, hey, even no matter what your decision is, or no matter where you're at in this process, we're going to put our arm around you. We're still going to welcome you back. Right. And because you'll still have someone else that's causing some conflict, or that's kind of saying, hey, well, this isn't working for me. I'm not going to do this anymore. The hell with this, and so on and so forth. But if you're able and fortunate enough to have enough people that are at a place where they're in that preparation, they're further along in that their stage and their readiness of willing to accept some of the recommendations, you're in a good place. And the aspect, especially with the medical community, is where is that person in with regarding their medical treatment? Right? Mm-hmm. Are they at a place where, I'm tired of being alone. I'm tired of, dealing with this condition. I'm tired of the isolation. I'm recognizing the impact that it has on my family, or I'm recognizing that, I've gotten to a place where it's not helping my situation. Like I'm more miserable because I'm by myself. Or you have some situations, especially in the health community, where they haven't received any validation from anyone at all. Which is, I think, one of the benefits of having and going to a support group is that even if you have family members and friends that are supportive, they still may not know exactly what you're going through. And it's difficult for them to sometimes really understand exactly what you've been experiencing. So I think that also plays a part in some of that social, rejection, and some of the things where they maybe aren't taking on some of the recommendations when they go to a group or where other people are at. So it's taking into consideration, where is this individual in regards to their medical treatment? This person might be coming to a group, or especially like say in the smoking thing, where I'm looking for immediate results, right? I'm expecting to come to this group, and I'm gonna, if it doesn't help me stop smoking, or it's gonna take away my urges, then I don't want anything to do with it. It's not gonna work. So I think that also, when they're able to get some people and they can maybe actually see some of the modeling, which I think falls into Lev Vygotski's zone of approximal development, where when you see a peer doing something or at an area of development where you're trying to get to, it's sometimes more beneficial for that peer to help that person along, because now that person can see that it's like they're modeling for that person. And so I've seen that sometimes, or observed that in the medical population, of just kind of seeing, okay, where is this person at regarding their treatment and their openness to different suggestions or recommendations. Sometimes a person, if they're in that pre-contemplation stage, they're just there. They're not really open to seeing things, or even open to that, other different recommendations. But some of the folks that are maybe more further along, and then even the group, right? When the group, like in the excerpt, when they're able to put their arm around someone, even despite of where that individual is, and they're like, "Hey, we're going to get through this because we were there at some point in time." Makes all the difference in the world. So that's why it's so crucial for the medical population to be able to have a support group or to have that to find that community. It's so crucial. I'm happy to hear that you've been doing that for such a long period of time and offering it. And the thing is with being a facilitator, and I'm sure you've experienced this, is that a lot of times the best that you're able to do is provide the information. Right? You're still coming from that humanistic approach of, hey, this is the information I got. Whenever you're ready, to accept it, whether you are or you aren't, we're still going to be here. We're going to welcome you in, because the last thing you need, even though you're experiencing this, is to be even more alone. And you never know also what that person might have been experiencing prior to coming into that meeting or prior to coming in contact with the rest of the group.
Mm-hmm. Excellent. Well, Dr. Osbourne, I really appreciate you sharing your insights with us today. And thank you for presenting that information and talking with us today. How can people get a hold of you if they have any questions or want to talk to you?
Probably the best way is via the social media platforms. Dr. Kyle O on Instagram, Dr. Kyle O on Facebook. I'm also myself and my good friend and colleague, Dr. Jason Coleman, and we have a podcast called the Black Psychologist Podcast, where we discuss issues as it pertains to mental health and physical health. We discuss current events, pop culture, news items, in particular, especially as it pertains to the psychological and human behavior aspect of things. So, we typically, we that's on YouTube. It's on iTunes, Spotify, Google, iHeart, all the different streaming platforms where that can be met. Also, people, if you want to reach out to my email, if you have any questions, dr.kyle.osborne, osbourne, @gmail.com. For any questions you may have, speaking events or anything, I always try to be as much helpful as possible. Even that's why I may do a couple TikToks every now and then, just kind of doing some mental health awareness things. Is that the more information we have about whether it be a psychological condition or our medical condition, the more information we have, the better off we are in managing the issues. So absolutely feel free to reach out to me on any one of those platforms, and I'm always happy to help.
Okay, great. And I'll certainly put those links in the show notes. Ladies and gentlemen, Dr. Kyle Osbourne.
All right. Thank you, guys.